Here I am going to describe the esophagus. The other way, it is simple way, it is called food pipe. Whatever we eat, masticate, it goes in bolus to the stomach in the abdomen. And that tube which passes from the mouth to the stomach is called the esophagus. And you can see this is an organ which is hidden in the chest. And we don't know how the food is going or not going. But if you feel that food is going, that means something is wrong in the food pipe. Okay, now I will show how it looks like by endoscopy. See, this is endoscope. You can see very flexible tube. It is not like those days which is rigid like now, it is very flexible like a thread. And after sensitizing the throat, we pass the scope and patient don't feel it is going through, very symptom. If also we give small injection dose, we don't feel. So now you are seeing it oral, air passage, then we now entering into the esophagus. Now you can see we are going down the esophagus. It is like a tube, mucosa is like a pinkish. Now we gone, now it is lower end of the esophagus, about to enter into the stomach, there is a slight resistance, it is high pressure zone. Once that the high pressure zone passes, then we enter into a big pouch, that is a stomach. So this is where normally you look at. Any disease in the esophagus, we can identify by doing this endoscope. Endoscope is the gold standard test today. And there are various diseases can come in the esophagus. And it can be GERD, everyone is calling GERD, no? As heartburn. The acid in the stomach refluxes into the esophagus, producing a burning pain in the chest called heartburn. Many suspects it could be a heart attack also. So this acid when goes to the esophagus and it creates inflammation. Initially it is reddish, later become ulcer. So this heartburn can easily detect by endoscopy, and when ulcer develops also we can detect by endoscopy. That ulcer due to reflux acid called Barrett's esophagus, and once ulcer develops it is called pre-cancerous stage, and later it will become the cancer. The third another disease is that lower end of esophagus, instead of high pressure zone and pressure will load down, it automatically opens up as such like a open door. Those people, it is condition is called hiatus hernia. There are some cases even the junction of the esophagus stomach can go into the chest itself. Many of them only can be by testing we can identify. So that is called hiatus. Third is the high pressure zone become more pressure. Many people, young people at the age of 5, 10, 20, they swallow food, but food will not go into stomach, it will stuck there. And because it will not open, and no mucosal ulcer, but not open, it is called achalasia, not distending at the site. Then another condition is, stricture. Some people would have corrosive swallowed without knowing it is, and that would have created inflammation. So tight opening, it is called stricture. Then can the tumors, and the tumors can be two types. Ulceration, the mucosa, it is called carcinoma. The other is muscular tumor which presents outside, it produces a bulge. Everything can be seen by endoscope easily. These are the common diseases, easily can be identified by endoscopy. If a tumor, then further testing is there, we will